What about things like exercise? We'll take each one of these separately. How important is that?
Well, exercise is invaluable. Between diet and exercise, you're covering a great deal of all the requirements to really reverse the type 2 diabetes. And one of the things I like to talk about with exercise is not just that you're getting the exercise, which is of course excellent. You're getting cardiovascular, which is lovely because, as we know, type 2 diabetics have a significantly elevated risk. Really what they mostly die of is cardiovascular disease. So getting the heart in shape with aerobic is great. But they're going to get their blood sugars under control by doing resistance exercise more, by building their muscle. Resistance exercise can burn 19 times the glucose that aerobic can. And then when you have just more muscles and you're sitting in this wonderful interview, you're still burning more glucose, since muscle is premier energy burners of glucose. But the thing we forget also with exercise is, what I tell patients is, when you're exercising, dress to sweat.
Yeah.
Because we forget that if we have type 2 diabetes and we're insulin resistant, likely we have environmental toxins just by, as Dr. Krinian says, eating, drinking, and breathing the air of planet Earth. And so we forget, our culture is so disenfranchised from sweating. We live in these air-conditioned homes, and we don't want to sweat. It'll give us, make our, put a little spot here on our dress clothes. But when we're exercising, that's your free-for-all, to dress for sweat. And even because not everybody has a sauna or can go to the sauna, but if you can sweat and soak your shirt while you're on even that treadmill, you're not only getting the exercise and the value, but you're detoxifying. And so it's a wonderful combination to really work on that important level of environmental toxicity, as well as the cardiovascular and the building muscle.
Great, fantastic endorsement.